Hey everyone, my name is Rebecca Reid, and my poster is over my thesis that I finished last October, a systematic literature review on increasing spontaneous MANs in children with autism spectrum disorder via MAN training. So in my introduction, I covered kind of the history of autism and the struggles that people with autism sometimes have with communication. So for example, this was cited by Sundberg et al. 2002, and Boonin et al. 2014 made the point that this poor communication potential can lead to social difficulties and maladaptive behaviors. ABA is one of the most common treatments to work with this population and to work on these communication skills. Usually we target this in the form of verbal behavior, as described by Skinner 1957 in his book of the same name. So verbal behavior includes elementary operants such as tacts, echoics, intraverbals, textual behavior, transcription, and MANs. MAN training specifically is often used to reduce these deficits in communication in children with autism. Previous reviews on MAN training have used limited definitions of MANs, such as in Shea et al. 2019, they only use specific MAN frames, or these reviews have had extremely broad population ages, such as in Mansell 2006, where they covered an entire child age range. So my current study aimed to determine the effects of MAN training on MAN repertoires of children 2 to 5 years old with autism. So to conduct my review, I used a variety of specific search terms on databases such as PsycInfo, ProQuest Central, and Web of Science to find my initial articles. So this ended up resulting in 341 articles. I then screened the articles for duplicates and removed any that were duplicated, and then screened the abstracts of those remaining to determine if they met inclusion criteria based off of participant ages, interventions, and any other valuable information within the abstract. So this left me then with 318 articles. After looking at the articles based on that, I was able to narrow it down to 86, and these 86 articles were further assessed reading the full study to ensure that they met all the inclusion criteria. After viewing these 86 full studies, I ended up with 18 articles that met all inclusion criteria. The articles were then coded by several different variables, such as year, research question, purpose, participant, demographics, research designs, intervention modality, and the presence or absence of variables such as measures for social validity. I also calculated effect sizes for each of the studies, and IOA was collected on all of the studies. So my results showed a lot of different trends. First of all, there were some just general findings I noted. The first of these is that there were 5 major experimental designs used in the studies. The most common design used was multiple baseline design. And another trend I noticed is that all of the studies tended to measure the study duration in different ways. There were 5 primary ways that studies measured their length of the study. These were sessions, weeks, opportunities, days, and months. Only 2 studies had explicit research questions, and there were 5 general purposes, and each study had a purpose listed. These general purposes were to increase MANs, decrease problem behavior, promote generalization of MANs, replace existing MANs, and increase vocalizations. When viewing the total participants for all of the included studies, there were 52 participants. Each study included 1 to 6. There were 42 males and 10 females total. The age range for participants was 35 months to 5 years old. Only 5 of the 18 included studies reported the ethnicities of their participants. And there were a variety of comorbid diagnoses with participants. Some of these additional diagnoses, in addition to autism spectrum disorder, included pervasive developmental disorder, impulse control disorder, disruptive behavior disorder, attention deficit hyperactivity disorder, global developmental delay, speech and language impairment, and Fragile X syndrome. I also further categorized studies by intervention. So the general intervention for all of them was MAN training, but only 7 of the studies used traditional differential reinforcement for MAN training. So I wanted to look at what some of the other variations of MAN training used were. So there were 11 variations, and they included ones that included most to least prompting, mandating to peers, MAN training with immediate and delayed reinforcement, video-based training, picture-based training, training for MANs for help, and training for mands for wear. Since motivation is key when it comes to manding, I thought it was important to assess how many studies included a preference assessment, and 13 of the 18 included a preference assessment. Interventions were implemented by a variety of people, so this included researchers, therapists, teachers, graduate students, and the participant families, and in a couple cases, multiple categories implemented the intervention. I also measured or recorded the intervention modalities to determine if there were any trends in how many studies were assessing different modalities. And so the modalities assessed were vocal, sign language, augmentative and alternative communication, and other, so anything that didn't really fall into those categories. The most common modality was vocal. And then I also assessed the intervention site. So this measured if it occurred in a school, home, or clinic. And schools and homes were actually the most common intervention site. Next, I coded all the studies by their dependent variables and measurement systems. Dependent variables included things like vocal mands, maladaptive behaviors, mands using sign language, alternation of mands, mands using AAC, replacement mands, task completion, and gaze shifting. And then measurement systems also varied and included percent correct, frequency, percentage of intervals, count, percentage independence, response per opportunity, percentage of trials, latency, duration, and rate. I decided to also assess whether studies included generalization and maintenance tests. So 6 studies included tests for generalization, 9 studies included tests for maintenance, and 8 studies did not assess either generalization or maintenance. I also measured how many studies included treatment integrity data and what that treatment integrity data was. So 12 of the 18 studies included this data, and the range for treatment integrity was 90 to 100%. I also measured how many studies were including social validity measures, and only 6 of the 18 studies included this. Lastly, I determined outcomes and effect sizes for all of the studies. Overall, 11 studies found an increase in spontaneous manding, 4 studies found a decrease in maladaptive behaviors, 3 studies found an increase in general manding, 1 study found an increase in task completion, 1 study found a decrease in prompted mands, 1 study found an increase in mands for information, and 1 study demonstrated an increase in gaze shifting as a form of manding. Effect sizes range from 0.53 to 1, with a mean effect size of 0.89. 2 studies showed a weak effect size, 3 showed a medium effect size, and 10 studies showed a strong effect size. Unfortunately, 3 studies could not have an effect size calculated due to lack of data. So next section would be discussion. So overall, my study was able to show that mand training is effective at increasing mand repertoires of children with ASD. So since current reviews use broad definitions of mand and narrow definitions and broad age ranges, my study kind of rectified both of these limitations. Interestingly, the picture-based method of mand training demonstrated the highest effect size, but this only included 1 study, so this may not be an accurate picture. The most common interventions were traditional mand training and most to least prompting. Studies with the highest mean effect sizes were implemented by teachers and families, but again, these are also small samples, so this may not be an accurate picture. And then my study also did have several limitations. So the participant age range that I used, ages 2 to 5 years, did not necessarily account for developmental milestones. This age range was chosen because it's a typical preschool age range, which was the population I was most interested in, but it may not provide an accurate picture of where that age range should be at as far as their mands go. In addition, the study only included children with a diagnosis of autism spectrum disorder. So that automatically eliminates a lot of potential children who have other difficulties with communication but do not have a diagnosis of ASD. Another possible limitation is that all of the studies with a strong effect size were a multiple baseline or multiple probe design. So these studies typically had more data included, and that may have provided a more accurate average, but we can't be sure, and so further research needs to be done to determine if multiple baseline and multiple probe designs lead to higher effect sizes. And then it's also unclear whether the presence of a preference assessment affected data for each study. So the implications of my literature review really just indicate that main training is effective at increasing means in children with ASD, but future research is needed to rectify the described limitations. Thank you.